Restless legs syndrome. Symptoms and home remedies. A person with restless legs syndrome experiences twitchiness and discomfort in the legs, usually after going to bed. As this can lead to insomnia, it is considered a sleep disorder. Restless legs syndrome or RLS may happen because of mental or physical problems, or it may be an adverse effect of some medications. It is also known as Willis-Eggbom disease. Restless legs syndrome may be classed as mild or severe, depending on the frequency and severity of the symptoms. How well the symptoms can be relieved by moving around, and how much disturbance they cause. It affects up to 1 in 10 people at some time during their life. The vast majority of cases of restless leg syndromes resolve on their own over time, or once simple lifestyle changes have been made. Symptoms. Symptoms can occur when a person is awake in a confined space, such as an airplane seat or at the cinema. As restless legs syndrome leads to difficulty falling asleep and staying asleep, the person may be tired during the day. This can have an impact on learning, work, concentration, and routine tasks and activities. Lack of sleep can eventually lead to mood swings, irritability, depression, and undermined immune system and other physical and health problems. What does it feel like? A person with restless legs syndrome has a strange and unpleasant sensation in the legs and sometimes the arms, and a strong urge to move them. People have described these feelings as aching, burning, crawling, creeping, similar to electric shocks, itching, tugging, tingling. The only way to relieve the discomfort is by moving the legs. The sensations tend to occur when the individual is resting or inactive, and not only during the night. Symptoms often worsen in the evening and at night, and may be relieved for a short while in the morning. How long will restless legs syndrome last? Symptoms of primary or idiopathic restless legs syndrome typically worsen over time, but for some people, weeks or months may pass without any symptoms. If the restless legs syndrome stems from a condition, illness, pregnancy, or medication, it may go away as soon as the trigger has gone. Pregnancy. Restless legs syndrome can pose problems for women during pregnancy. Women who already have restless legs syndrome can find that symptoms get worse during pregnancy. However, becoming pregnant can lead to restless legs syndrome in its own right. Symptoms tend to get worse as the pregnancy progresses and are especially likely in the third trimester. The cause of the increased incidence of restless legs syndrome during pregnancy is unknown, but the following factors are believed to be involved. Low levels of minerals or vitamins such as iron and folate, sleep deprivation as a result of changes in the body and discomfort, changes in the hormones, increased sensitivity of the senses. This condition has not been widely researched during pregnancy. However, some of the drug treatments used outside of pregnancy, behavioral treatments such as mild exercise and a healthy sleeping pattern, are often recommended as a first-line treatment for women during pregnancy. If iron levels are low and thought to be the cause of restless legs syndrome, oral iron supplements are safe to prescribe during pregnancy. In severe cases, higher concentrations may be administered intravenously through a drip. If another cause is suspected that may require medication, and the above treatments do not have the desired effect. Drugs should be prescribed at the lowest possible doses to reduce risk. Types. There are two main types of restless legs syndrome: primary or idiopathic restless legs syndrome. Idiopathic means that the cause is unknown. It is the most common type and has the following characteristics. It usually begins before the age of 40. It can start as early as childhood. It may have a genetic cause. Once primary restless legs syndrome starts, it tends to be lifelong. Symptoms may be sporadic or gradually worsen and become more prevalent over time. In mild cases, the person may have no symptoms for a long time. Secondary restless legs syndrome. A secondary disorder is caused by another disease or condition. Secondary restless legs syndrome usually starts after the age of 45 years and it does not tend to be hereditary. This type of restless legs syndrome is distinctly different. Onset is sudden. Symptoms do not usually worsen over time. Symptoms may be more severe. Diseases and symptoms that can trigger secondary restless legs syndrome include diabetes, iron deficiency, kidney failure, Parkinson's disease, neuropathy, pregnancy, rheumatoid arthritis. Exactly how restless legs syndrome happens is not well understood, but it may be related to how the body processes dopamine, a neurotransmitter that plays a role in controlling muscle movements. Some medications affect the activity of dopamine. It is also linked to pregnancy. Around 20% of women experience restless legs syndrome during the last trimester of pregnancy, although the reasons are unclear. Periodic limb movement disorder or PLMD. PLMD is a similarly related sleep disorder, sometimes called periodic limb or leg movement during sleep or PLMS. In people with PLMD, the limbs twitch or jerk uncontrollably while sleeping. It is also considered a type of sleeping disorder. The movement may cause the individual to wake up frequently during the night, and this can undermine the quality and length of sleep. It can lead to restless legs syndrome. Remedies: lifestyle changes and common medications that may help alleviate restless legs syndrome symptoms include warm baths and massages. This can relax the muscles and reduce the intensity of symptoms. Warm or cool packs. Some people prefer warm, some cold, and others say that alternating hot and cold is helpful. Relaxation techniques. Stress can make restless legs syndrome worse, so exercises such as yoga, meditation, and Tai Chi may help. Exercise using legs more can help alleviate symptoms. If the patient has a sedentary lifestyle, walking instead of driving, taking up a sport, or exercising the legs in a gym can help. Sleep hygiene for restless legs syndrome. Sleep hygiene is important as tiredness makes symptoms worse. Tips include sleeping in a cool, quiet bedroom, going to bed at the same time every night and getting up at the same time every morning. Reduce the amount of light you are exposed to for an hour before bed. Avoid stimulating drinks such as caffeine or sugar. Avoiding or reducing alcohol consumption and tobacco. Exercise and physical activity can help restless legs syndrome, but it can also aggravate it. Most patients find moderate exercise helpful, but too much can make symptoms worse. Working out late in the evening may also be unhelpful.